It's considered your brain's equivalent of a heart attack. Strokes can be disabling, even fatal, and impact about 800,000 people a year here in the U.S. Here to talk about symptoms and survival, I'm joined now by Dr. Rabih Tawk, cerebrovascular neurosurgeon at Mayo Clinic. I got through it. Hey,
Thanks, Anne. Thanks for having me.
Dr. Tawk, thank you so much for being here. Can you just explain what is a stroke?
Stroke, the name of stroke implies a sudden direct hit to the brain. And it could be it's an insult to the brain, could be happening from a bleeding to the brain, or could be happening from blockage of a blood vessel where there is not enough blood supply. So that's the word stroke.
And those are two different kinds of strokes. Can you tell us a little bit more about each of them?
That is correct. So the hemorrhagic stroke happens because of a weak blood vessel and it leaks blood. For example, some people have heard about an aneurysm, which is a bubble on a vessel because the arterial system is pressurized and the vessel becomes weak and suddenly pops. There's other disorders that cause this. So hemorrhagic strokes tends to be associated with headaches because there is added blood to the brain. Silent strokes, in terms of patients' symptoms not having headaches, are mostly ischemic. It means there is blockage of a blood vessel, lack of oxygen supply, and it depends what vessel is exactly blockage. It will be loss of function associated with the area. So let's say carotid artery, sometimes it's the whole right side or left side of the brain. And that's how patients present depending on what they have exactly.
And so if the hemorrhagic stroke maybe is associated with a headache, what's the other kind of stroke typically associated with in terms of symptoms?
The best acronym to remember of a stroke is BFAST, BEFAST. So B is for balance loss. Anytime you have problems with balance, walking, coordination. E for eyes, meaning you lose vision. Okay, and then the FAST is face, facial droop. A is for arm weakness, and S is for sensory or numbness or some tingling or something, and then the time, T is for time, it's time to call 911. So what we want to make sure that the public knows about any of those things. Commonly people say, hey, I'm just going to wait and see how I'm going to be feeling tomorrow morning, and then I'll see. Time is brain. On average, there is some studies show that roughly we lose 2 million neurons a minute. This is an average, an estimation, but this tells you the impact of getting to the hospital and acting fast. So we have the time and the chance to open the vessel, reestablish blood flow to the brain, and save the brain.
So I've heard of something called a golden hour when it comes to stroke. What is that?
Again, it comes from the time is brain, because once you have a vessel that's blocked, you're in a race to establish the blood flow and restore oxygen delivery to the brain so the brain functions again. So, it's every second matters for those patients.
And is there a time past which you just can't make any difference in what has occurred?
The time barrier, I've been doing this for many years. Initially, people thought about the 3 hours, 4.5 hours, but we knew upfront that the faster, the better. Basically, we still intervene on some patients several days after they have a problem. And sometimes it's a blocked vessel and patients don't have a problem unless their blood pressure drops down and they need something else. So the concept of time is, I would like to deliver the message to the public, is that when you think about it, go seek medical care. That's how I want everybody to know about that. It's very important.
And there are different parts of the brain that can be affected by these different kinds of strokes. I would imagine that causes different impacts down the road.
Absolutely. The brain is like real estate. It's location, location, location. So some parts of the brains are extremely important for our function, and some parts are less important. Okay. And in specific people, for somebody like your job versus a pianist or a violinist, so those parts of the brain, is it the speech? Is it the coordination? You have the artist, the ballet dancer. All these functions become much more important. But the brain is organized in such a way that we know what part of the brain executes what function. For example, you have an area that moves the arm, the finger, the legs, the area where the leg, you feel your leg, where you talk, where you get the information to process, where your vision. and you have the connections from all those parts of the brain to the body. So it depends on what area gets, an injury, and that's the function that's translated to it. And I want to make sure that people know that a stroke can be silent. And some people, they come to us with multiple silent strokes and they never know it. That's why we do imaging and we look at the brain, and that's how you figure out what's going on.
What do you mean by a silent stroke? You mean no symptoms at all?
No symptoms at all. You can lose part of the brain that is that has less important function without knowing it, or could be very mild or subtle that you didn't even think it's bad enough to know, or to go to see a doctor.
So, what are some of the genetic or lifestyle risks of stroke?
I mean, the common things are hypertension, diabetes. These are very common, and then the things that come with our social life, smoking, food consumption, and then the genetics of you cannot absorb the fat, like hypercholesterolemia, triglycerides, and then there is things associated with drug use. Some people, use drugs, and those can cause injuries to the vessels, and there's other disorders that can cause problems with the blood vessels. For example, blockage of blood vessel. For example, moya moya. It's a Japanese name for a puff of smoke. It's a disease that affects the carotid artery, and it is particularly it happens at the carotid after it goes when the carotid goes up in the neck, goes into our skull and the brain cavity. The blockage happens into the carotid before it bifurcates inside the brain cavity. So this is a disease that we still don't know why it happens. Now, if you have the risk factors, you're likely to have a worse outcome because you add things up. Just like driving on a snowy day or icy day and it's a storm, it's a higher risk of having a car accident. Same for the brain. So it's important to be aware of those risk factors, mitigate them, dissipate them, know about them, and try to keep yourself healthy.
So I've read that there's some additional, concerns that are developing. A study that was published recently in the medical journal Neurology, finding that climate change could exacerbate stroke risk. That people who are exposed to really high temperatures or really low temperatures can suffer more strokes. And that I would guess is kind of an emerging science, obviously one that we're learning more about all the time.
Absolutely. Again, the stroke is a result of so many things. If we focus, for example, let's take moya moya. Okay, those patients have blockage of blood supply to their brain. Suddenly, they're up in the heat. It's summertime. They get dehydrated. So your heart is the pump, your vessels are the pipes, and the brain is the organ you want to receive blood. So their heart is fine, their vessels are blocked, but now you have less blood in your system because you're dehydrated. So there is less delivery of blood to your brain, and you get affected. And many of those patients, we advise them to keep drinking water, don't get dehydrated, don't get out in the heat, and avoid those things.
So you are at Mayo Clinic. You're having an event that focuses on stroke. Who do you want to attend? Who is that intended for?
This is an event where I think it's important for us as physicians, communities, and patients to all come together and sit down outside the operating rooms and the clinics and to say, hey, let's sit down and talk. And this event is nothing more than this. It just shows that our institutions are interested in putting us together, physicians, techs, IR staff. The hospital team comes as well. Patients come. You see their families with them. You see the young woman who delivered her baby last year, now walking with her son or daughter. You see their families with them, and everybody comes together to this event. They share their stories. They learn from each other, and they take a stance to say we are here together. And this event is just for that. We have a very symbolic walk where people walk together as well inside. We do it. Some of those patients are devastated from their disease. Some of them are still functional and they have top jobs at top facilities for a job that requires a lot of brain activity. So we are trying to abolish the effect of this disease. We're trying to make patients do better and live better life. So this is the event. We come together. May is Stroke Month, Stroke Awareness Month. We want to make sure that people are aware and we want to sit down and celebrate this fight against stroke together.
For people who do suffer stroke, how important is rehabilitation and how effective?
It's equally important. So in the sequence of a fight, you have the attack and then the clean. So rehab is very important. When the brain is injured, there's other areas of the brain that can take over. They can help regain some function and rewiring of the network, basically.
Well, Dr. Rabih Tawk, thank you so much for being here. It's really nice to meet you.
Thank you for having me.